systems is so important. So around the continent, as we all know, we have extreme weathers, we have food insecurities, we have shifting disease patterns that are putting extra pressure on already fragile health services. So our focus tonight is on moving from risk to resilience, how we exploring how stronger systems, better preparedness, and community-driven solutions can help protect vulnerable populations and ensure that healthcare remains accessible, reliable, and responsive in the face of climate change. So, just an overview of what EcoHealth Africa is all about. So, EcoHealth Africa is an interdisciplinary organization dedicated to addressing the growing intersection between climate change and human health. As global temperature rises and extreme weather events intensify, healthcare systems worldwide face unprecedented challenges in protecting population health. So our organization serves as a bridge between climate science and healthcare practice, providing evidence-based education, research, and advocacy to strengthen health system resilience and improve health outcomes in a changing climate. So, that is what our webinar is going to cover tonight. And before I bring up our speaker, I believe that we have all shared the links. We have all shared the links on our status and our stories. So in few minutes, I'll be bringing up our speaker in person of Dr. Aishat Oduye. And before she comes up, I'll read a bio for us all to hear. So, Dr. Oduye Aishat, a Nigerian medical doctor with over 5 years of experience as a dedicated climate health advocate and project manager. Her work is centered on the intersection of public health, climate education, and youth empowerment. She is deeply committed to creative, inclusive climate solutions by amplifying the voices of marginalized communities, especially youth and women in Africa, and ensuring their experiences are reflected in global policy. Our advocacy is driven by our first-hand experiences with the devastating health and social impacts of climate change in Nigeria, both as a citizen who has lost property to flooding and as a physician treating patients with climate-exacerbated illnesses. Dr. Aishat has demonstrated significant leadership and impact through various cures. As a senior programs manager at You Recycle Initiative Africa, she has led impactful environmental projects across 11 African countries, engaging more than 10,000 young people. With Young Go, the official youth constituency of the UNFCCC, she has held several leadership positions, including internal co-lead of the Health Working Group. A notable achievement was delivering the Global Youth Statement at pre-COP29, where she represented the voices of over 80,000 youths from around the world. Her extensive portfolio includes managing successful campus-based sustainability fellowships, leading community conservation projects, and conducting research on the health impacts of plastic pollution. Looking forward, Dr. Aishat's primary goal is to bridge the disconnect she has observed between health-focused climate advocacy and technical innovation. She seeks opportunities to build interdisciplinary connections that can produce scalable, tech-enabled solutions for climate-related health challenges. By participating in global forums, she aims to advocate for systemic change through policy innovation, financial reform for sustainable infrastructure, and the protection of indigenous people's rights. Our ambition is to leverage further training and collaboration to advance climate and health policy, strengthen the resilience of vulnerable communities, and empower a new generation of leaders to build a sustainable future. Please, with joy in our hearts, I want us to welcome Dr. Aishat Oduye, who is a climate and health expert. Dr. Aishat Oduye, you're welcome. Please, I want to also encourage us to kindly use the chat session to drop our suggestions, whatever we want to say, emojis. Kindly use the chat session to do that. You're welcome, ma'am. Dr. Aishat Oduye. Over to you, ma'am.
Thank you very much, Grace. It's very nice to meet you. Hi, everyone. I am already sharing my screen, so I apologize that I might not be able to, engage with the chats, right? Because I'll be on my screen. But thank you so much for the warm welcome. I'm really, really grateful, and I'm happy to be here. Uh, Climate and health is a very important topic that I'm happy we're talking about now, because it's been a couple of years where we've talked about climate change, and now people are now talking about the impact of climate change on health, which is very, very significant, right? Because it goes beyond climate change having an impact on the environment, or it goes beyond having biodiversity loss. There's loss and damage and everything else. It has an impact on our health, and I'm happy that we're recognizing it, especially at EcoHealthAfrica. And I'm very excited to be here. So I prepared a slide. I would need somebody to please unmute and respond to me. I know that you want to use the chat box like Grace has said, but unfortunately I can't see that because I'm sharing my screen. So please confirm that you can hear me clearly. Let me know that we have good network.
Yes, yes, you're very audible. You're very audible.
Okay, perfect. Can you see my screen?
Yes, yes, yes. Very clear.
Can you see me? Grace, can you see me?
No, no, no. We can't see you. We are just seeing your screen.
Okay, I guess that's how Telegram works then. Let me turn off my camera then, I guess. Okay. So our theme of the day, you guys, I like your interactive session. I'm very hurt that I can't use the chat box because I need you guys to be giving me emojis from time to time. So maybe Grace, you can help me with that. When I ask a question, you can maybe just respond to what people are saying on the chat if they are, or I'll just go back and forth. Right. So our theme is from risk to resilience, a strategic framework for climate adaptive health systems in Africa's marginalized communities. This topic is very dynamic, very interesting, actually. Whoever came up with this topic is a brilliant person, right? Because he's multifaceted, and we'll be talking about it. So, hi, everybody. I am Dr. Aishat Oduye. Grace has been so kind to read my bio. Those are a few things that I've worked on in the past couple of years, and I'm very grateful for the opportunity to, do some work in this space. I'm a medical doctor in Nigeria, and I'm a climate and health expert. I'll be taking you on a journey. So I tend to talk fast. So please let me know if I'm going too fast, because this is going to be a training session, right? So before we get into the topic, what's climate change? What are we talking about? Why are we talking about climate change? So it refers to long-term changes at the Earth's average weather patterns, right? So including temperature, precipitation, and wind, the changes that occur in the Earth's average weather patterns. So over a period of time, usually decades or longer, is often caused by both natural processes and human activities, especially burning of fossil fuels, which increases GHG emissions and leads to global warming. So I just put a few pictures here of desertification and impacts of climate change and forest fires. So how many people knew about climate change or know about climate change? Because it might be some people that want to know about climate and health, or some people that already know about climate change, they want to know the intersection about climate and health. I sort of want to know the intersection. Okay, so I'm on the chart now. Let me just see a show of hands. How many people are aware about climate change? They know about the impacts. They have an idea. If you don't, you can just put I don't. Okay. Grace knows. Of course, Grace. Grace, you have to know. If you don't know, a whole host. And I want to see sort of like the demographic of the kind of people that we have on the group. All right. Okay. Messi is typing. Just one more response and we can go back. Okay. So I'll just infer and say a bunch of people know about climate change. So let's go in depth, right? So you guys will obviously know about global warming and how trapped gases in the air is causing warming the earth by us trapping in sun rays, right? Moving on from that, that's what's causing climate change, the entire global. What is vulnerability? So this is what concerns me with our topic. Remember, our topic is um even I just forgot myself. From risk to resilience, a strategic framework for climate adaptive health systems in Africa's marginalized communities. So I want to explain to you what a marginalized system is. So what is vulnerability? Vulnerability is the predisposition to be adversely affected by climate change. So you can see a formula that I've drawn here, right? So let's go forward before we come back a bit. What is susceptibility and what is vulnerability? Susceptibility is based on biological conditions such as diabetic patients, age, basically things that people cannot change, right? People don't have an effect on. So being a child and you are susceptible to maybe meningitis compared to maybe being an elderly person and you are susceptible to osteoporosis because you are older and you have less bone density, right? You are susceptible to those diseases because of your physical traits or sorry, of your biological traits. Sorry, was somebody saying something? Grace, are we good?
Yes, 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 we are good.
Okay, so you're susceptible to those diseases because of your biological traits, right? Hypertensive patients are susceptible to diabetes, for example. They are not vulnerable. They are susceptible because of what? Their biological conditions. However, vulnerability is the other way around. It is either physical, economical, social, conditions that cause you to be vulnerable to something, right? Which is what I mentioned that they are predisposition to being adversely affected. So these are things that have physical effects, such as what, right? Insecurity, poverty. Either you are staying in the village, either you are staying in the town. This makes you either vulnerable to something or not, right? So those are physical and economical. So let's just come back now to this formula. This formula says physical vulnerability plus socioeconomic vulnerability, excuse me, equals climate vulnerability plus likelihood of exposure equals to risk. So I'm going to give you the formula for what risk is, because I'm moving from risk to resilience. So you need to understand what risk is first before we now move on to the solution. You need to understand what the problem is before we move on to the solution. You need to understand what risk is before we move on to resilience, right? So being physically vulnerable or socioeconomically vulnerable equals climate vulnerability. We've agreed. So you being vulnerable plus the likelihood of exposure. So for example, you somebody staying in Lekki, everybody knows about the Lekki flood that happened this week, right? You staying in Lekki because of your urban location, because of where you're staying, right? Everybody there is vulnerable. So what's the likelihood of exposure? We know that rainy season happens during this period of time. Like it's likelihood of exposure has increased, right? So when you add those things together, it makes it you not term those people are lucky as people that are at risk. Do you understand? So you can't say somebody that is in, let's say Ibadan now, for example, right? I'm in Ibadan. There's hardly any there's hardly ever any occurrence of flood here, right? So even though my um my socioeconomic slash physical trait is that I'm in Ibadan. Yes, we've agreed. I'm staying in a house. Okay, that's fine. What's the likelihood of a flood happening in Ibadan? Very slow, very little. What does it equal? I have a low risk to flooding, or I have a low risk to the climate impact of flooding. Are we following?
Yes, ma'am.
Perfect. So let's now define what resilience is. Now we understand what risk is. We're moving on into resilience, right? Resilience is the preparedness and rapid, effective, and efficient response to or and recovery from. So really, I wanted to underline the parts that were important in this. So let's just take it one word at a time. So preparedness. You're preparing for something. You know that there's a risk. You know that there's a potential for exposure for this thing, right? So you're preparing. That's the first part of resilience. You are rapidly and effectively and efficiently responding to. So when flooding happens, when forest fires happen, how quick are you to send help? How quick are you to respond to that? That's resilience. That's number 2 point. And how do you recover from that? How will people from Atleki recover from the flooding that has happened? People that have lost property, some people have lost lives, some people are in the hospital. How does a community quickly recover from that? Right? It's basically what resilience is. So those are the 3 parts. So I know that this topic had mentioned that we should effectively talk about adaptable climate adaptable health systems, and permit me to change it, right, to climate resilient healthcare systems, because resilience has 2 umbrellas, and we can't do one and not do the other. I've already answered my question. I wanted to give you guys tests, but let's see if you guys will still are following me. I need 3 responses to this question. Let's first define what adaptation is. Adaptation and mitigation are how to achieve resilience. So I told you the 3 parts of resilience. You are preparing, you're rapidly and effectively and efficiently responding to, and then you're also recovering from the effects of climate change. Right. So adaptation is basically adjusting your social systems and infrastructure to current and projected climate change impacts. Right. So what are we doing now to adapt, quote unquote? Okay, we are currently exceeding the global temperature that we want. How do we adapt to it? Okay, by 2030, the Paris Agreement says we should not exceed 1.5 to 2 degrees Celsius. Right. So IPCC has done research and said that the worst case scenario will probably exceed, I think, 3 to 4 degrees Celsius. Best case scenario will do 1 to 2 degrees Celsius. So based on that, that's our projected outcome. What are we doing? What are we changing our behaviors to suit that? That's basically what adaptation is. We know that, okay, there's flooding in Lekki. What are we doing about it? Are we doing more drainage systems? Are we doing warning systems? Do you understand? You know that in the north there's a lot of there's a lot of heat waves going on. What are we doing? Are we doing cooling technologies? Are we doing crop diversification for the desertification that is going on in the north? Right, that's adaptation. But however, mitigation is fine, there's a problem, but how do we, I don't want us to only just say we're adapting, right? How do we reduce the greenhouse gas productions to reduce future warming? Right. Okay, you've already given us the worst case scenario. What do we do to reduce that and make sure that doesn't occur? So every step that is going towards mitigation will say, okay, hey guys, let's reduce and reduce global warming. Adaptation is saying, hey guys, global warming is here, global warming is happening, we need to survive this. What do we do? So based on my 2 explanations now, which one would you guys vote for? Between Thank you, Peter. I just saw your chat. So which one do you guys vote for between adaptation and mitigation? 2 different things. There's one, hi, global warming is happening. Should we we need to survive this. Let's put in systems. Or 2, let's prevent future global warming for our future generation, even for the next 10 to 50 years. Let's reduce global warming. That's mitigation. So which one would you guys pick? Adaptation or mitigation? Which one is more important than the other? Messi is typing again. I need 3 responses before we can move on. We've already spent 30 minutes. I've not even entered my topic. Sure, you know. This one is just preliminary, just giving you guys the gist before we enter. Mitigation. Messi says that we need to reduce global warming for our future generation. Moses agrees. Wow, everybody is agreed. But your topic says, I thought you guys know what your topic says. That we're working on global climate healthcare adaptation strategies for African. There's a lot of them. Rani KG. All right. So for me, this is a very huge argument in the climate change space, is that we shouldn't have to pick. We should have systems, and it's very dynamic because honestly, if you are doing adaptation to a very large extent, you are doing mitigation. For example, right? Okay, well, not always, not always. But for example, you get a clinic that works on solar energy, which means they have little carbon footprint, right? And from that solar energy, they have cooling systems, right, to take care of the people that had heat stroke or people that have heat emergencies, right? So if you look at that kind of situation, now they are both mitigating and they are adapting. So right, we're already feeling the heat now. However, we can go clean by doing the adaptation strategy. So it needs to be, that's why I said that I want to change the topic. Because if you just want to go to adaptation, I can get a cooling system. I can get ACs in all the wards, and my carbon footprint is increasing. Right? You're not dealing with the problem that is causing the what you're trying to adapt to, which is not good, right? It's not good enough. So you have to be able to prevent and also solve at the same time, right? Does everybody following me, please? Almost 7:30. Okay, let me see if I can. Okay, I think I'll just use my phone to see your chats. Yes, yes. Okay, thank you. Fantastic. So let's get started. All right. So the unfolding crisis, this is where we're at. Africa is at the epicenter of the climate health emergency. Right. There's an escalating climate crisis that's often discussed in terms of global temperature anomalies, atmospheric carbon concentrations, and complex meteorological models, yet is the most profound impacts that are deeply personal, measured in disrupted lives, compromised health, and shattered futures. There's so many people that have been impacted by climate change, and honestly, if we're going to talk about the impacts of climate change, we will not leave here this night because it is so multifaceted, right? It's so bad that we have people that have eco anxiety, that mental health disorders that come from climate change. We have people that have lost family, they've lost property, their lives are getting damaged daily. And unfortunately for us, which is why this is an unfolding crisis, which is a crisis for Africans, is that we contribute the least to climate change. However, we are the ones that are getting impacted the most. I need you guys to understand that and think about it. We contribute the least, but we're getting impacted the most. So if you look at the research done across the world, you see that Africa is always at the short end of the stick, whereby we don't have enough industries, we don't have enough sources of climate change that is negatively impacting the climate. However, we're the ones going through flooding, we're the ones going through food insecurity, we're also the ones going through desertification, we're going through people that are dying from heat stroke daily, right? We're contributing. When the KG doesn't believe, please check it. And unfortunately, there's a very ugly, dangerous cascade. I'm not sure if I put it here. Let me see. I don't think I did. Okay. I didn't put it here, but I'm just going to explain it. Is that, for example, you guys, we already have, let's say we have a clay pot that's already cracked at the bottom. I'm explaining our health crisis to you in Africa here. We already have a clay pot that is cracked at the bottom and is holding enough water. I mean, for people in the house to not die from thirst, right? But water is still leaking regardless. And then these people just come and start pouring water inside, and then the clay pot starts to crack more, break more until we have no clay pot anymore. That's basically what happens. That's what's happening with our healthcare system, right? We already have a fragile healthcare system, but because of the impact of climate change, it's now negatively impacting our healthcare system. That which is now also negatively impacting climate change in itself as well. So it's a dangerous circle. Climate change is impacting health. Health is also impacting climate change, right? We don't have enough healthcare professionals. We don't have enough healthcare facilities, and everything we're doing, unfortunately, we're moving towards industrialization now here in Africa, and we're increasing our carbon footprint. And because of that, we're causing more impact on climate change. But because of what every other person is doing in the world, and obviously, it's not that we're not at fault at all. It's just that we're not also rich enough to even pay for the problems that they've quote unquote put on us, right? I'm talking about us contributing to the list, right? So climate change is impacting the health, our healthcare system. Healthcare system is also negatively impacting climate change. So it just keeps going back and forth, right? And there's almost no way to breathe in between that. So IPCC confirms Africa's exceptional vulnerability. The continent is warming at a rate that outspaces the global average. Within Southern Africa, experiencing warming at nearly twice the mean global rate. That means that if the entire world is warming at 1 degree Celsius, Southern Africa alone is doing 2 degrees Celsius, right? This accelerated warming is not a gradual, manageable shift. It's a catalyst for more frequent, intense, and unpredictable extreme weather events, right? And everybody's experiencing it now. I know, remember during dry season, it was so hot during dry season, and everybody was wondering where. I think we're entering 30 something degrees Celsius per day, right? And then there's increase in sea levels that's causing more flooding. That's also, I also going to explain that when I'm talking about the pandemic, right? It's also causing animals to move into regions where humans typically stay. So they're moving closer to us and they're leaving their environments because it's not palatable to them anymore. They can't stay and they can't adapt to those environments anymore. So they are bringing their pathogens, they're bringing new viruses, they're bringing new bacteria and whatnot, and bringing it closer to us, and we are now more susceptible to pandemics now because of climate change. That's one of the impacts, right? So impacts on health, we have more, or we have an increase in public health emergencies. So there was a comprehensive review of over 2,000 public health events on the continent that was done between 2001 and 2021, and they found that 56% were linked to climate change. More than half of the events that have happened for the past 2 decades is linked to climate change. Just think about that for a second. And it's not like you're going to your hospitals and you're hearing about it from your nurses and your doctors. Nobody's talking about the fact that climate change has such a deep impact on our public health, and it's very, very bad. But I'm happy that platforms like this exist and we're talking about it, right? So economical loss, like I said, is a vicious cycle, right? We currently are losing $2 to $4 billion annually, and we'll keep on doing that by 2030, right? And these funds that we should be using to pay for primary healthcare, to invest in infrastructure, to train more healthcare workers, we're trying to use that to mitigate the impact of climate change. So we're wasting money. Does that make sense? In its right, it's almost like, okay, the house God forbid, somebody's house got burnt, and you are using money to buy water so you can put out the fire. Do you get? That money could have been used for somebody's school fees. That money could have been used for somebody's food or for somebody's trip, but they are using that money to put out fire for the house, right? So how do we mitigate and ensure that that fire doesn't take place anymore? That's basically what we're talking about here. And how do we reduce the economical loss for Africa? Because this is a very huge burden. Impact on the environment. This is a no-brainer. There's extreme weather. There's extreme weather events, heat waves, storms, floods all over the world. And I know that Nigeria in itself, first of all, Nigeria in itself is such a dynamic place, right? Because in the northern part of Nigeria, as we speak, like I said, they're going through desertification there. However, on the southern side, we're going through something else entirely, excess water, which is flooding, right? And it's very, very sad that within the same country, but that's just to tell you how dynamic it is. And if you now look at Africa as a whole, I know that they like to put us all together at once and say, "Oh, Africa, the problems Africa is facing." Africa is such a diverse place, and there's so many issues that different countries, even within the same, like I've explained with Nigeria, even within the same country, they are facing different issues that are related to climate change as well. So in as much as we want to group them all together, we also want to ensure that we're the marginalized voices, but within the marginalized voices, there's also vulnerable voices that needs to be heard as well. So I just want to just put it out there. 1 second. But you guys following me though? Please let me see emojis.
Yes, ma'am, you're following.
All right, thank you, Grace. I'm using Telegram on my phone now, so I can see people's chat. So let me see you guys. Let me see emojis. Yay! Thank you. Wow, that's a lot of emojis. You are making me blush. Stop. I'm emotional. All right, thank you guys for paying attention. I love this so much. All right, so again, back to our topic, you guys. Everything that we're talking about is still under our topic. That's why I said the person that came up with that topic is a brilliant person. Kudos to EcoHealth Africa. Focusing on marginalized communities now, right, is a compounding vulnerability. And you guys remember what we talked about earlier, right? About what vulnerability is. So, I was actually sent a case study of Mr. Audu, right? So, in the heart of Jigawa, Nigeria in the central western part of Africa, Audu is a young, successful farmer with a family of 5 who did well until drought struck his region. This led to malnutrition and diarrhea due to failing crops and contaminated water in his family and community at large. There are many people like Audu and there's no doubt that Africa is the continent most vulnerable to climate change, right? Basically. So within this very, very short story that we've heard about Audu now, you see that Audu is facing, it was just drought. I mean, it's not something that is in his control, but he is living and getting his livelihood from farming, from his farm. Do you understand? So he has a climate sensitive livelihood. You know how they're talking about it now that AI is replacing people's jobs? A lot of a lot of jobs that Africans have, a lot of jobs that Nigerians have, a lot of jobs that people have are usually tied to the climate. And when anything strikes, again, not in their control, they tend to go through food and water insecurity. Do you understand? So that's why it's a compounding vulnerability. You take out what a man is supposed to be using to feed his family. What's the second one? We have a pre-existing health burden already. Africa was already facing a lot of public health issues. We have vector-borne diseases, right? There's malaria, there's water contamination diseases. And because of climate change, do you know that after flood occurs, there's an increased rate of diarrhea, there's an increased rate of water contaminated disease, obviously, because contaminated water from the flood has entered your system. You are supposed to be using to drink water, your quote unquote clean system that you were using to drink water already. So the already public health burden that was already existing before, the pre-existing health burden, is increased because of climate change. Right. So that's why I say we're at the short end of the stick, unfortunately. Right. Secondly, infrastructure deficits. So you guys, everything I'm mentioning here they are all physical factors. Do you understand? They're all physical factors, and I can see how that relates to vulnerability and not susceptibility, right? So infrastructure deficits, like people that are lucky now that have lost their homes to water, right, to the flood that has happened, and people that have done that before, people have experienced that before them as well, right? So let me give you guys a fun fact. Do you know that every year during climate change, during the rainy season, every year during the rainy season, there are people within this country that move from their homes to different regions, and when the rainy season has ended, they will go back to their houses. Why? Because their previous houses are usually flooded and they cannot live there. So we have internally displaced persons that move yearly because of climate change. You know how disgrunting that must be for you to have to move out from your house 4 months in a year, every single year, because of flood. It's very, very painful. Right. So we have climate refugees and displacement. And then there's social determinants of health, right? Other factors like poverty, gender inequality, disability, age, all of these are even susceptible items, right? But they come under social determinants of health. So I forgot to tell you guys what adaptive capacity is. Let me just quickly explain what that is. So let me use me and Grace for example. Me and Grace are living, our neighbors. We're living in the same community, right? We're talking, we're gisting, we're friends, and when did I even say we're talking, we're gisting? Anyways, that's not even the point of my story. Me and Grace were in the same neighborhood. However, Grace, sorry, okay. Anyways, let's put Grace as the Grace has a bunker, right? She has access to $1 million, and on the other end, the other person, because it cannot be me, the other person, right, doesn't have access to a bunker. They don't have access to money to even build a fence to block when there's sea level rise. Let's say we're living at the coastal regions, right? They don't have money to build a cement fence to block that, but Grace does. She has money, she's comfortable, she has built her cement, and whenever there's maybe an earthquake or anything, or there's a flood, she goes to her bunker and she locks herself in there. She already has food that will keep her for the next 5 months, and once the flood is gone, she'll come back out again and she's good, right? See now, me and Grace, or the person and Grace, we have the same vulnerability, we have the same risk, while living in the same community, but Grace has an higher adaptive capacity than me. So you see people that live within this same Lagos, even in that same Lekki, some people have already moved out of their house before flooding happened, because they knew that, oh, when this flooding begins, they cannot be caught here. They've already traveled out. They are still there. Those people they have the same vulnerability, they have the same risk, but the person that traveled out has a higher adaptive capacity. So when you start to calculate vulnerability or risk index, you have to put in adaptive capacity as well. So that's something that's one you just add in there. Sorry, did somebody say something? Excuse me. Are you guys following me? Okay.
Yes, yes, following you now.
All right. Thank you. So we have different case studies, right? Climate-driven health crisis. So again, fun fact again, you guys, if you start to study about the impact of climate change on vector-borne disease, it's so sad, it's so dynamic, right? Is the fact that there's I don't know if I'm sure there are healthcare professionals on this group, and have you guys noticed that recently you'll be seeing more patients that come back and say that their malaria has not gone?
Yes, yes, that's very true, ma'am.
Yeah.
Very-
So rising temperatures, altered rainfall patterns, and increased humidity, all of these are favorable environments to the mosquito. So mosquitoes are supposed to maybe die. I'm saying maybe now because this is not a backed fact, right? I mean, what I'm about to say right now is not the backed fact. The fact that, let's just say, mosquitoes live for 5 days, but because of climate change, because of the rising temperatures, because of the rainfall patterns that have been altered, mosquitoes are living for 10 days. Do you understand? So they are healthier. The vectors are healthier. Them, they are mutating and they are adapting so much so that the drugs that we're using to treat them are no longer working. And there's also the conversation around it about us even growing resistance. Some people just take medications without knowing when they're supposed to take on or when they should stop taking it, right? And people just buy it because, oh, my head is paining, that is malaria drug. So there's also resistance, right? So yeah, is that anti-malaria resistance? Because I know about antibacterial resistance as a short form. Anyways, so there's also that as well. So that's happening. That's happening with every year. Thank you, Marenike. So that's happening with every vector-borne disease out there. There's also increased cases of allergens. There's also increased cases of people, adult onset asthma, or people that said their asthma has gone in the past, but now they're having more episodes. Why? Because there's a study that was done that said the physiology of pollens are changing. like what makes up pollens themselves are changing, and is now making it more difficult, and is now triggering human beings to obviously gain allergies from that. So there's now increased onset of asthma and other respiratory diseases because of climate change. So if there was supposed to be rainy season for 4 months, and we have rainy season for 5 months, or we have rainy season for 6 months, for example, right? The person's original exposure to pollen should have been maybe 4 months originally, but because of climate change, that has extended the season, thereby extending their exposure. Now that we have 6 months exposure, but apart from that, carbon dioxide in itself, which is a huge greenhouse gas, is now changing the properties and the characteristics of pollen in itself. And pollen is a lot of people are usually allergic to pollen, right? And it's causing more people to gain more allergies and worsening the people that already had allergies before. Do you get? So it's a double-edged sword. Climate change, that is. So water as a weapon, this is no news. Apart from destruction of properties, we also have the outbreaks of cholera, diarrhea, and waterborne diseases, right? And then I was trying to explain what the pandemic precursor was. That climate change is increasing the likelihood of future pandemics, right? It's creating conditions where we have zoonotic animals move into where we are at or where we are, because where they were before is no longer palatable for them. So they are moving and migrating into places that are close to us, thereby increasing the likelihood of a pandemic. Some other things I didn't add on that slide: heat, malnutrition, mental health, because climate change directly deals with food insecurity, and we know how much money we're losing on food in itself alone, especially here in Nigeria, right? So it's a really deep issue. Okay, so forging a path ahead. What do we do next? The path from risk to resilience is both urgent and achievable, right? So there are a lot of countries that are working on, I think I read recently that it was Sweden, I think it was Sweden, yeah, that they recycled and they used their waste so much into circular economy that they started to import waste from other countries because they ran out of waste in their country. And I posted on my status then, I was like, we can do it too, right? So it's very much achievable for us to move from risk. We've identified that Africa is at risk. We identified that we have so much to do, right? Because we have to fix the problems we had before. Now, fix the problem that's been escalated by climate change that we have little to no hand in, right? But we need to synthesize and learn from global innovators. How can we tailor what all these people have done? There's something else that I saw online. Is a kind of moss. Is it moss? I can't remember, but it's an algae, right? They use it to light up the streets. I think it's in Switzerland, right? So what it does is it converts, like every other plant, it converts carbon dioxide to oxygen, and it also glows in the dark. That's basically it. So even if instead of planting trees, because there's also the conversation about afforestation and it being suitable. This is why I said that you have to tailor it to Africa's needs. You have to tailor it to your community, right? We love trees. Trees are good, right? Places that have trees are usually cooler, and we see them converting carbon dioxide, which is a greenhouse gas emission, into oxygen. Greenhouse gas into oxygen, right? And that's great as well. But when we have poles and we have power lines, we can't have trees growing into them. When there are storms or there are floods, right, we can't have trees falling into poor people's houses. So what is the best alternative for this kind of thing? This is where you go into innovative ideas, like that algae I talked about in Switzerland, right? So would that work here in Nigeria? Would that work there in South Africa? How do we adapt global innovations? As are ways that we can go about it. So I created a roadmap anyway. Excuse me. It's a five level, there are 5 pillars to it. right? It's not obviously a rigid prescription and say, oh, hey guys, if we do this, Africa's problems will be solved. But it's definitely a step forward. And one of it is strengthening governance and leadership, right? Governments must break down institutional silos that impede effective climate action. So, we know that health impacts of climate change cannot be managed by ministries of health alone, right? So, a genuine One Health approach is required, and knowing that we need to foster deep collaboration between health, agriculture, water, and environmental sectors. So, you're not coming at it and saying, oh, we have a malaria problem, let's give them more anti-malarials, let's give them the malaria vaccine, right? We're coming at it and saying, oh, hey, how can we combine this agricultural system, the water sector, the environmental sector, and tell them to clean out their drainages, to build better drainages for them, because a cleaner environment, reduces the incidence of malaria. Do you understand what I'm trying to say? You're not joking about it and saying they're just fixing the problem, fixing the problem. Prevention is always better than cure. So you're looking at it holistically. You're looking at the patient and not the disease, quote unquote, right? So this is very, very critical for tackling interconnected challenges, right, of zoonotic diseases, food insecurity, and water safety. So you're doing more than just solving one problem. You are solving the multifaceted issue by doing interconnected collaboration. There's also there's actually something that we're supposed to develop, which is the um national adaptation national adaptation plan. That's NAP. Every country is supposed to do that, right? We're also supposed to do the nationally determined contributions. These are NDCs. Is a part of the Paris Agreement, and every country is supposed to submit. Countries like Uganda have already taken this step, and they've already added that they want to improve their early warning systems for disease outbreaks as part of their national plan. This is something that we can do here in Nigeria, right? That's what the role of government and leadership is, and also how they can also fund innovation, right? We have NGOs that are working on sustainable solutions, circular economy solutions. How can they help these people? How can they fund them? How can they give them the right spaces or rooms for them to pitch their work, or basically adapt what they are doing into the system? Because do you know that there are obviously, I'm sure you know, right? If we set up a solar plant in the north and take advantage of the sun, access to sunlight that we have there, right, will power the entire country on clean energy, which is solar energy. We have a lot of water here in the west. Why can't we do a hydro mill? Do you understand? And so on and so forth. Just basically taking advantage of every single sector's power, and just reducing the impact and adapting as well to climate change. So you are doing mitigation and adaptation together, right? So my second pillar would be building climate smart health infrastructure. What does this look like? So we're going to adopt green and safe standards. We're ensuring reliable off-grid energy through solar power. We're implementing water conservation and rain power harvesting systems. This was done in Cape Town. We're also utilizing passive cooling designs. We're also using sustainable materials to reduce energy demand and operational costs. So these are ways that we can, adapt, but also mitigate as well, which I mentioned earlier, by building climate smart health infrastructure. That way you have a resilient healthcare system. This third pillar is what we're doing here, right? We're empowering communities from the ground up, which is known to be the most effective strategy, right? We're doing community-based adaptation, which conceptualizes adaptation as a social process originating from the specific needs, values, and capabilities of the people most affected. So when Grace comes and say, hey, she's coming from Makoko, for example, and she has experienced all sorts of impacts of climate change, and here she is saying that, okay, I would really like to solve this problem or solve that problem because I've experienced it and I've seen that this works and this doesn't work. If Grace is in the room when we're making decisions, we won't go to Makoko and go and do something that would work in Badagry, for example, knowing that Makoko's lived experiences, people that have lived there knows what they know what they work rather, right? So we have to bring in people from the community, people that have lived these experiences and they can advise appropriately. So basically empowering communities ground up and also and giving them the tools, lecturing them, teaching them, and letting them know that they also have a role to play. Don't burn your refuse. Use less plastic. Keep your drainages clean. Not the government will not be the one to come and clean your drainages. Let me know that if you guys are still with me. How many of you remember Environmental Day when we were growing up? Let me know if there are only Gen Zs on this group. Do you guys remember Environmental Day when we were growing up?
Yes, yes, yes.
Okay, good. So every Thursday, was it Thursday? I can't remember what day it was.
I think every
Or
last
every last Saturday, like nobody was allowed to move out. In my own place, it's every Thursday. We don't open shop until 10 a.m.
I think for some cities it's Thursdays, for some it's
Ah, okay. Everybody must clean their gutters, pick out the weeds, clean their environment, and make sure that it's very, very clean. But that has stopped now. We're now cool, aren't we? We're too big for that. Unfortunately. Right. These are some of the issues that we're going through. Okay, harnessing data and technology, which is the fourth one. I'll quickly run through since we're almost out of time. Right. So this is where early warning systems comes into play. These systems must go beyond just forecasting for future weather. They're supposed to be smart, right? They need to translate climate data into specific public health risks. And we know that um we don't have enough healthcare workers at Lekki, for example. I'm saying Lekki because that's was the most recent flood incident. But we don't have enough health workers in Lekki for the foreseeable climate emergency that's about to occur. They'll now mobilize and say, we need 50 more health workers in Lekki. This is about to happen. That kind of early warning system that is both able to tell you, run away, there's flood. Did you know that you should drink? Have you taken water today? There's the temperature is 32.5 degrees Celsius. You're at risk of health stroke. There's also telling and reaching out to the right offices, to the right professionals and experts, and telling them that these people need help in this older community, right? So that kind of dynamic and smart early warning system would really go in a long way. So basically harnessing data and technology. The fifth one and the last one is securing sustainable financing. This one cannot go, we can't even talk about this enough. Climate financing is such a dynamic and huge topic, right? Remember I told you guys earlier that we're not impacting as much to it. So there's something called make polluters pay, right? We're not impacting as much to climate change, but we're telling them, hey guys, you need to pay. Hey guys, you are the one that is quote unquote, not really quote unquote, you guys are the ones that are contributing most to climate change. That means you should pay for what you are doing. Basically, that's making polluters pay. So once they're able to finance, we can now use it over here in Africa to upgrade our systems. But that's not the reality. Because it's not just only Africa that is going through it. There's so many other countries that are vulnerable and they are marginalized, right? But they don't contribute as much to the polluters, but they have most impact like the way Africa does too. So last year during COP, was a very sad experience that we didn't get what we wanted because I think we entered with a couple billion in mind and we came out with 200 or 300 million, right? Okay, I'm concluding now. From aspiration to action, these are the 5 pillars. You guys have heard about it now. You know what to do. Talk to your next person. Talk to your family members. If you're a healthcare professional, talk about it. This is a collective responsibility and a call to action to every stakeholder. You have a role to play. Every single person has a role to play here. For policymakers, champion this agenda at the highest level of government, right? Drive the integration of health into climate policy and climate into health. For healthcare professionals, become advocates for resilience within your own facilities and communities. Talk about it more. Participate in vulnerability assessments. Champion sustainable practices. Use your trusted voice to educate the public. When a patient comes in and they don't understand what's going on with the malaria, don't tell them that your drug is fake. Don't tell them that, oh yeah, it's a lie. Maybe you have something else. Maybe you have typhoid, right? Talk to them about the environment. Talk to them about climate change. do the health talk and climate talk together. Educate other people as well. That's your role as healthcare professionals, right? For researchers and innovators, focus on implementation science. Please provide evidence needed to refine and scale up community-based adaptation models, right? Because it's very important to note that community-based adaptation models is is the most important thing, right? Like I said about the algae lights. It might not work here in Africa, but it's working there in Europe, right? For civil society and community leaders, continue to lead from the ground up, which is us, right? This is what we're doing here. Ensure that the voices of the most vulnerable are at the center of all planning and decision making. The journey from risk to resilience is formidable, but it's a journey Africa can and must lead. It's an investment not merely in clinics and hospitals, but in the human capital, economic stability, and sustainable future for the entire continent. The time for aspiration is now over. The time to act is now. Let's act now for our planet, our future, and the generations to come. I remain Dr. Aishat Oduye. That's my name on LinkedIn. If you want to connect with me, feel free. I'm happy to connect back. That's also my email. You can DM me or email me with questions if I don't respond to your question here because of time. I know that we're past time. Or you want to collaborate on anything, feel free. That's my email. And with this, I say thank you. Namaste. Merci. Arigato. Arigato gozaimasu. Asante. Thank you guys for your time. Obrigado. Any questions? If you have any questions, over to you, Grace.
Oh, wow. Thank you so much, Dr. Aishat. Unfortunately, Grace cannot continue with that now. Thank you so much. I believe everyone enjoyed the session just like I did, and the session was really insightful. So please, if you have your questions, kindly drop them in the chat box so we ask our speaker. Now we're wrapping up already. So I'm waiting if you have any question for Dr. Aishat. Okay. Nobody's dropping anything. Okay, that means everybody understands what risk to resilience means. That means everybody understands the
Can we do
difference between
exam?
adaptation and mitigation. All right, yes, over to you, Dr. Aishat.
I think can we do exam? I don't have anything to. Glory is asking a question.
Um, someone is asking if there's going to be a recording. Yes. This session will be uploaded on YouTube. Okay, Moreni Kejimi, you'd like to talk. Okay, over to you, please. Hi, Moreni Kejimi, you said you have a question and you'd like to talk. Over to you, please.
Please, you pay for my slide though. Now my slide is expensive. Marita, we
We
can't hear you.
you.
Please, Moreni, can you please unmute your mic? Unmute your mic, please. Probably your mic is muted. That's why I can't hear you.
It's unmuted. I can see our rank is unmuted. Mambi network. About my slide, I'll discuss with. All these things can be found on the internet. I don't mind. I'll share it. How can small clinics in rural areas begin to incorporate climate information into daily patient care? Okay, so is
You can now
multifaceted,
speak.
right? Yeah, I don't think she can because it's unmuted. So I'm trying
Yes,
to answer Grace's question. Okay. So for Grace, the simple and straight answer would be again multifaceted, but incorporate climate information. First, train the healthcare professionals, right? Tell them they can do it. It's possible. Within your 5 minutes of seeing the patient, you can bring in a little one or two about climate change and how they can, do better with their own personal practices. How you can clean your drainages, like I've mentioned before, to prevent flooding, right? How you can stop burning your refuse. Switch from this, switch from firewood, for example, to electric cooker. Even electric cookers have carbon emissions, but now we're doing between fireman or fire, right? Which one is worse than which? Because you cannot have a child that has asthma and you're still using firewood, right? Those kind of conversations can be integrated between the healthcare professional and the patient. I know that there's something we do in the hospitals where we do antenatal care and we do health talk every morning, depending on the group of people you're talking to. So, for example, if let's say 10 people come every Friday to come and see the orthopedic surgeon, for example, or 10 people come every Friday to come and see the cardiologist, or whoever doctor it is, you can just say, oh, after the register, everybody sit down. As the nurse there, you've already registered everybody, do a 5-minute health talk. But now you're doing a climate and health talk. No, so it's not just, oh, you're singing songs with them doing antenatal care, right? You're integrating climate change into it as well. I can go a step further, talk to your MD, see how you can liaise with the local government officials. Do you understand? How can we
Yeah.
bring up posters to train more people as well? Okay, Morenke speaking. Hi.
Sorry for interrupting, ma.
Oh, it's fine. I was
Okay.
rounding up.
Yeah, thank you for the for today's discussion. It was a nice one. We really appreciate it. Thank you very much, ma. Yeah, concerning
You're welcome.
you listed five. If I'm correct, you listed 5 ways by which we can mitigate this climate. What is really affecting us? Yeah, if we look at number 1 deeply, which was the leadership and that leadership aspect, I think based on what I'm thinking, I would like you to just maybe yes or no. Others can't work if there's no good. I'm not saying it won't work, but may not be really effective if the government and this leadership aspect is not in place. Because even organizations, NGOs, a lot of like infrastructures which can help keep manage or mitigate these health issues are tied to the government, whereby if there's a bad governance on all, these things may not function well. But I don't know, maybe I'm correct now, but I would like you to shed more light on that. Please, did you get me, ma?
Yes, I understand everything you've said. Now I'm of 2 different opinions concerning what you said. I would agree and then I would disagree. I would agree because we are living in Nigeria, right? We're not living under a rock. We understand what's going on with the dynamics here in the country, and unfortunately, almost every country on the planet is going through it, right? And there's just some sort of disparities with our leaderships around the world, right? Every country has a problem, quote unquote, almost all, with their governments, right? So you can almost say yes, because of that, if they don't change the policy, I can't do anything. If this doesn't happen, I can't do anything. But now, well, this is where my second opinion comes in, that's an excuse, right? Why? Because there are other people that are doing the same thing you're doing, right? There are other people that have been where you are and they are making changes, right? So as a government, as a non-governmental organization, as a civil society organization, you have people that have done this for 15 years and they have numbers behind them. They have impact stories, right? So how they do it in spite of, right? So I'm also very much of the opinion that whatever you're doing, if you're not advocating alongside, you're not doing anything. Which is why when I was answering Grace's question, I said it was multifaceted, right? You train the healthcare professionals. You also talk to your local government offices, local government officials, and see how you can integrate what you're doing into the government level. Do you understand? And now Nigeria is so dynamic because we have policies. The problem we have now in Nigeria is implementation. How is it that we can implement the policies that we already have into the system that we live in today? Do you understand? So when you sit down, you look back, in spite of how do we create a solution? Do you understand? So I agree with you from the first part. You've seen that there's a problem, you've identified it, but you have to sit down with your other colleagues. How do you create a solution and move forward in spite of these problems? So that's my response. Also, you can be the next president. Start working towards it. When you get there, you change things as well. But until then,
Yeah, thank you very much, ma. I really appreciate it. Thank you very much, ma.
You're welcome.
Thank you. Yeah.
All right. I think in the absence of any other question, I will now give it back to Sharon. I think you were speaking. Thank you very much.
Right. Thank you very much, Dr. Aishat, for that beautiful response. Is there any other question? Okay, this is 8:13, and Dr. Aishat, would like to have your LinkedIn profile so that we could follow you on LinkedIn and all social media platforms. Thank you so much. Okay. Thank you so much, everyone, for joining. Thank you so much for joining this session. We look forward to, having you in our next webinar session. I hope you learned a lot. I hope you learned and took something home. You're taking something home that you would make use of, right? Climate change and health starts with us. It's not just okay. Sorry about that. So, learning about climate change and health is not just for, like I used to say, um, if you take precautions yourself, you are saving a lot of people. And once you point accusing fingers at one person, it's coming back to meet you, in threefold. So basically, we all have one thing or the other to do. We all can do something about this. We all can do something about this. Thank you so much for joining. We'll also share the links to EcoHealthAfrica's social media platforms. Kindly follow us for more information, for more updates. We'll be having our next webinar next month. Until then, bye bye. Good evening and good night, everyone.